Ashley is now going to prime the vented tubing with the alteplase, using caution not to discard any of the solution. She is now ready to program her pump. So she will set up her tubing and program her pump so that the infusion will be programmed to administered over 60 minutes. Ashley is confirming the settings with her order on the MAR. When reconstituted, the infusion vial becomes a 1-to-1 ratio. Once she has programmed her pump, she will confirm the settings with a second RN. She'll connect the tubing to the patient's IV. And then she'll use barcode scanning to first administer her bolus into her patient's second IV. This is going in over 1 minute. Once administered, she's going to use barcode scanning again to scan her vial for the infusion. And she will immediately start the alteplase infusion. For her assessment and documentation, Ashley will be doing her vital sign and neuro checks. These will be completed every 15 minutes, starting with the time onset of the time of the bolus. This documentation takes place on the tPA flow sheet. While assessing the patient, she is looking for adverse reactions related to tPA tPA administration, including angioedema, bleeding, and anaphylaxis. If the patient has a change in mental status, sudden onset headache, she will immediately stop the infusion, notify the physician, and prepare the patient for a stat head CT. Once the tPA has been infused, she will need to stop the pump, disconnect the tPA from the tubing, and spike her 25 ml bag of normal saline. So that she can flush the line and give the full dose of tPA to the patient. She will set her pump at the same rate as what the tPA was infusing at to begin with. When transferring the patient via beacon transport, Ashley is going to ensure that handoff occurs at the bedside. This handoff includes a review and confirmation of pump settings. Okay. Ashley will also make note of the total volume that has been infused to the patient prior to transfer, and she will make a note of this volume in a nursing narrative. When transferring the patient, if tPA is still infusing, Ashley would have made sure to send the flush bag with the patient upon transport.